Hey, good afternoon, and welcome to EliteHealthOnline.com. And today I have myself here, Clay, and Sadia from Texas Star Pharmacy. She's the lead compounding pharmacist there at Texas Star. Thank you, Sadia, for being with us.
Thank you so much. It's a pleasure.
Yeah, so today's topic is going to be subcutaneous injections with testosterone versus intramuscular. So this is obviously a topic that is gaining a little more popularity because so many patients now are utilizing HRT therapy, whether it be some sort of pellet therapy, creams, injectables often are the cheapest format. So many patients will migrate, Sadia, right, to injections at some point. They find out about that, but boy, if they have a fear of needles or just find that to be really invasive, they'll often move to what I consider often, it's not a bad therapy with creams, but we have sweat, you have transfer. It's not the most ideal way to absorb any medication, I don't believe. But talk to us specifically today about testosterone and what has typically not been, it's typically always been produced or suggested to be injected in an IM fashion, intermuscular. But talk to us about intermuscular versus subcutaneous, and is the science there to support doing testosterone injections subcutaneously if the volume is correct and doing smaller doses?
Yes, absolutely. So, SubQ or subcutaneous versus intramuscular, there is actually, about few years ago, it used to be just the IM route, right? Like for
Hmm.
testosterone, because you're going into the muscle and you're making like a small depot of the oil-based testosterone injection, and it's supposed to do like a sustained release type, mechanism. Now, the issue is the size of the needle that is needed is minimum 1 inch, or it can be 1.5 inch depending on the individual.
Hmm.
Now, when it comes to that, there is a pre-injection anxiety, and there's a pain during the injection, and of course post-injection. So there is a number of patients, when they look at the size of that needle, at least in the beginning, they have this anxiety that develops.
Sure.
So because, and especially women, they just
Hmm.
look at the needle and they decide not to go even try. So now, because of that, there is a study that is done where they kept the weekly dose the same, but they divided it into the same dose, let's say from 1 ml once a week to 0.5 ml twice a week, as a sub-Q. And pharmacokinetically, like basically how the testosterone releasing daily on from the site of administration, it remained the same. Patients were able to maintain the consistent level of testosterone within the therapeutic index throughout the duration of therapy. They did not have any complaints. Of course, patients' acceptability was very high with that, and of course, there is no fear of injecting the medication at 60-degree angle or 90-degree angle. It's just a straight sub-Q small needle base.
Yep.
So,
Excellent.
so basically, clinical response based on how the drug is absorbing subcutaneously was not route was very acceptable, and it was very equivalent to the intramuscular administration with less pain and less anxiety. One
That's
thing,
great.
one
So,
thing is, sure, go ahead.
no, I was just going to ask a quick question. I know, I believe that study as well, aromatization is a big factor, right? When men are, particularly men are taking testosterone and the impact on hematocrit. Did that study address the impact on hematocrit and aromatization? Was it less with sub-Q than it was with IM?
No, so basically they did not specifically, touch these two topics, how the
Okay.
aromatization was affecting it, or how the patient overall response. But they basically compared how testosterone is getting released into the blood stream from the site of action.
Okay.
One thing for sure, that's subcutaneous area is a huge area. It provides larger surface
Yeah.
area, so it gets absorbed faster, so the duration is not that long. So that's why it's so critical to divide that dose into two separate occasions, because it's reaching the system faster, but after 2 to 3 days, its levels are declining. So to prevent it, take the same dose, divide it into half, take every third or the fourth day, whichever works. But also, going back to your point, subcutaneous area is actually it's right underneath the skin above the fatty layer. So that fatty layer, of course, have more, aromatase enzymes. So such patients should be using some sort of either, botanical or, commercial or, grade, drug grade, basically aromatase inhibitors to prevent, again, the estrogen conversion from the testosterone therapy.
Excellent. And Sadia, that's the therapy I'm currently utilizing. I'm taking 1 ml testosterone a week, dividing that into 2 subcutaneous injections that are both a half a ml each. And it seems to be, I've been doing that now for 2 months, and I'm not noticing any decline in my therapy or any kind of impact. So but it is way less invasive. So
Yes,
that's great.
absolutely.
Great.
Right.
Awesome. Well, good to know. This is great information for patients who either are just really fearful of needles or tired of injecting themselves after,
Yeah.
years of being on therapy and having to do intramuscular
Sure.
injections. So it's good information. Thank you.
Yes. Sure.
So again, this is a reminder and disclaimer, always follow the directions from your provider. We'd be happy to take care of you at elitehealthonline.com. So please visit our website. We'll be happy to get you scheduled for lab work at a local lab corp, and then get you on with one of our providers and have medication delivered directly to your door within 48 to 72 hours after your visit. So please visit elitehealthonline.com. And Sadia, thank you for being with us today.
Thank you so much. Bye-bye.